The FDA is looking into reports that breast implants are linked to cancer, specifically anaplastic large cell lymphoma. Doctors have diagnosed more than 450 women in the country with that rare disease. Of those cases, 9 were deadly. We brought in an expert to talk more about this. Let's send things over to Marissa.
Bridget, thank you so much. And with me now is Dr. Don Parsi. He's a plastic surgeon, also former chief of surgery at Queens, and also a professor at the UH Med School. Thank you so much for being here.
Thank you.
All right. Now, first of all, how worried should people be if they have breast implants about this cancer?
Right. Well, I think the women should know that there are 2 types of implants on the market, and approximately anywhere between 300,000 to 500,000 implants are inserted each year in the United States, and up to perhaps 5 million worldwide. FDA had made a warning in 2011 about the possibility of a link between implants and special type of cancer, lymphoma, and aplastic large cell lymphoma in 2011. However, it was just a week ago, March 25th and 26th, that the leadership of FDA's member of the Implant Advisory Committee, met with the leadership of American Society of Plastic Surgeons with participation of public and patients. It's at this meeting that very important measures were taken. One of them basically answers your question: how often do these problems, cancer, develop? I think public should know that there are 2 types of cancer. They're either textured, meaning the implants, when you touch a surface, it's rough, and the other type of breast implants is smooth. These implants were introduced in 1962, almost 60 years ago. Later on, almost 10 years later, the rough surface, texture surface implants were introduced into the market, and they were used with patients and physician satisfaction. The reason they were introduced, because they stabilized themselves on this, within the breast, and they are associated with less incidence of hardening, of firmness, contracture. However, these are exactly these types of implants that we know at the present that will lead into this particular type of cancer, which has an incidence estimated at 1 in every 30,000 implants.
It's why very rare.
It's very rare. However, patients must be cognizant of this happening. I'd like to show a slide that shows where how these scar tissues and cancers develop. On the left side, you see an implant that has been freshly inserted. Within days, a capsule or scar tissue forms around the implant. All foreign bodies introduced to human body do form such a scar. However, it's within years. In average, 11 years it's been shown during recent studies and meeting with the FDA. It's the contact of the scar tissue with the implant that will cause a fusion of fluid that we refer to as seroma, and it is this seroma that is the warning sign of a cancer developing. There could also be, in about 40% of the case, a lump that's palpable or a lump in the armpit.
Is there something in the rough version, in the plastic or whatever it's made out of? Is there something in it? Or is it just the texture itself?
It's solely the texture, and there's certain immunohistochemical changes that take place at this interface. It must be said also that students at the John Burns School of Medicine did do a great deal of research work even prior to FDA's warning, almost 10 years ago or so, that implants may be related to conditions. However, there has been only 1 confirmed case of breast cancer, and that's good news, in Hawaii. Only one case.
Linked to this type
linked
of
to
breast
this
implant.
kind of breast implant. However, many patients are not aware of what kind of implants they have, so they need to consult with their physicians if any changes take place, particularly if they had the implant inserted some few years ago, up to 20, 30 years.
Okay,
So
that's the
there's
best advice, right? Consult your physician to find out which
Yes.
type and if you're having any issues
That's
as well.
right.
Right.
And studies can be done. I think the next slide would show to examine the fluid with needle aspiration. That's sent to pathology laboratory. And if that's positive, then patient should undergo perhaps other imaging studies.
And it's best to catch it early, right?
Yes,
Thank you
that's
so
correct.
much, Dr. Don Parsa.
Thank you.
Back to you, Bridget.